Morning. It's Wednesday, December 18th, and I'm sure all of you know that our healthcare system is the most expensive healthcare system in the world. But that does not mean that we are getting the greatest care in the world. It has come to my attention that the deny and delay tactic has increased by a lot in this country. And this practice is fueling anger at the U.S. health insurers. And the national data is not easy to get, but there are many doctors who say that treatment is increasingly being delayed by demands for pre-authorization, or it's being denied outright, and then there are actions taken to get that reversed. And that, of course, delays the treatment for many, many people. So this is not something that is out there in the open space for everybody to hear about. So I am happy to tell you some of the situation. Now, I'm sure many of you read about the United Healthcare executive who was gunned down on a New York City sidewalk. And the killer supposedly was upset because he was denied and delayed health insurance coverage. And many people spoke from personal experience that every year health insurance companies deny millions of patient claims for medical expense reimbursement. And that issue has been rising. Insurers have been increasingly demanding that doctors often obtain approval before providing treatment. And there are surveys that are showing that the causing in delays has been devastating to the American public. That's according to the American Medical Association. And there are several states that have passed legislation trying to restrict such practices. And that's because of the growing public anger. Insurers defend coverage denials and pre-authorization requirements. They say that those measures are meant to contain the rising costs. How can the costs in the U.S. continue to rise far above what other nations make their patrons pay for health insurance? And they are claiming that these delays comply with federal and state regulations. That's according to the information that the insurers report to the regulators. There have been only small increases nationally in the frequency of denials in recent years, according to those guys. But that is not really the case. The insurers are hiding a lot of information from the public. Insurance companies often act without explanation. They just send out a denial letter that offers only sparse justification. The patient gets a cryptic message saying it's not medically necessary, but without any other explanation. And that's what the vice president of the Community Service Society of New York has told the consumers. And his organization helps consumers appeal denials. People are mad because it's a big secret. It's unfair as a society that something so important is trusted to giant corporations that make money when they deny care. This is making many, many people in this country very angry. But I don't see that anger exposed often enough. So we don't know exactly how many claims are being denied or how many medical procedures are getting early scrutiny. It's very difficult to get this information. There is no real formal report about the regulations associated with treatment denials. And most of what is available only reflects one type of insurance or another. There's no national grid that shows how many people have been denied treatment and how long it takes to overcome the denial. And the rates of denial have been between 14 and 60%. That's according to data from the National Association of Insurance Commissioners. So what are we to do about this? It's very difficult in this country to do anything about healthcare. In Maryland, for example, regulators report that the number of claims denied by insurers that they regulate has risen by 40% since 2019. So here we are, this great nation with the most expensive healthcare costs and the most denials in the world. So there's a large majority of doctors and other healthcare providers who report that those insurers are denying more claims and imposing more pre-authorization requirements. And this is according to a 2024 survey conducted by Experian Health Company. And it indicates that 73% of healthcare providers said that claim denials are increasing. So here we are, a great nation with the most expensive healthcare costs in the world and the highest rate of denial. Does that sound fair? What are we going to do about this when we have so many people who are frustrated and they are clueless about how to get out of this mess? Now, patients have a relationship with their doctors. Their doctors know them. Their doctors are experts in their disease. Their doctors are experts, but the recommended care is denied. How can that be when we have an expert saying that this person needs treatment and it gets denied? It gets denied because the health insurers don't want to pay the claim right away. They'll wait another 6 months or so to pay the claim eventually. It's a tactic to continue to pile up their revenue. And we in this country should be demanding an instantaneous stop to all of these delays. If the doctor says you need treatment, that's all they need to know. He is a professional. You are looking over his shoulder and trying to steal money from the patients in this country. So I'm angry about this situation. Healthcare in this country is not as great as it should be, and the cost of it is outrageous. So I leave you with that this morning. This can't be a great day. Take care. Bye.